So I'm delighted to be able to say a few words at the launch of the undergraduate curriculum. I mean, doctors and nurses are the most highly respected by patients as sources of information and advice, and that includes advice on diet, nutrition and physical activity. And diet, nutrition and physical activity are known to play a major role in all aspects of health, growth and development of children, prevention and promotion of good health, the response to any ill health, and generalized health with aging. And therefore it is not unreasonable that patients have an expectation that their doctor can give them sound advice, that they have the knowledge to offer them safe advice. Against this, it's obviously important that doctors and nurses have the opportunity during their training to learn and understand what is important, what the evidence shows, and therefore what is the advice that they should give their patients from one situation to another. Unfortunately, the opportunity for doctors to learn about nutrition during their usual undergraduate training is limited and is not standard across the country, and this is a cause for concern as to how they manage to acquire the expectations that their patients have of them. Over the past little while there have been efforts to improve the situation, and over the last couple of years the students and young doctors themselves have made the point that they need to know more, they need to be taught better. And for example, students from the University of Bristol have been catalytic in bringing attention to the fact that something needs to be done. And the Association for Nutrition are to be congratulated for creating a space and forming a committee where all of those who have an interest in this area can come together and discuss how best this might be achieved, and to produce a document which lays out in simple, clear terms how the learning for undergraduate students might best be put together. This is a compilation of everybody's different thoughts and ideas, and has been widely exposed to others in the relevant communities to allow their comments and viewpoints to be taken into account. And so this document can be considered to be the most thorough statement of what and how young doctors might learn about nutrition in a way that is useful and appropriate for their patients. Nutrition permeates everywhere. It's fundamental to the way in which every cell in our body is able to carry out its function. And so it's not an add-on to the practice of medicine. It is central to the core of medicine and the delivery of medicine. And I'm delighted that we have a document that enables us all to work to a common format for a common purpose, which is to help the people who we serve achieve a better standard of health according to the best evidence available. The material is available online, and you can readily see it by accessing the website. And the Association for Nutrition, I'm sure, would be very glad to answer any questions that might arise. And we look forward to this activity creating a community of people, of practitioners who share their experience and share their knowledge and understanding to make it easier and better for everybody to lead a healthy and more nutritious life.